Our presenters are Karen Bethard from our Department of Nutrition and Teresa O'Feely from the College of Pharmacy here. And they're going to talk to us about with, from, and about facilitating interprofessional learning groups. So welcome our speakers.
Hey. Hi, my name is Teresa O'Feely, and Karen and I in 2018 participated in a community outreach event sponsored by TAM HSC, colleges across the TAMU campus, and some stakeholder partners in the community. And what we did at that time, it was basically a family event. Please advance the slide. Next slide, please. Okay, so our learning objective today has to do with trying to define facilitation, understand common facilitation challenges, identify effective facilitation strategies for interprofessional learning groups. Okay, so how do we define interprofessional education, or IPE? IPE, as defined by World Health Organization, is an experience that occurs when you have two or more health professions learn with, from, and about each other to improve collaboration and the quality of care. Okay, now, and that brings us to the IPEC core competencies. And for those of you unaware of what does IPEC mean, what does it mean? IPEC stands for Interprofessional Education Collaborative, which is an initiative formed by a consortium of schools of health professions that kind of thought about it, say, wait a minute, we graduate all these different graduates from different professions, and they go into the workplace and work with each other for the first time. How about we bring it into the classroom? Let us start right from the beginning and have them be able to start learning how to work with each other so that they will have a seamless transition into the workplace. And that's exactly what happened. And out of that came up these core competencies that have constantly been updated. And this is the latest update that goes into 4 different buckets. Okay, and this has to do with values and ethics, roles and responsibility, interprofessional communication, and teams and teamwork. When we talk about values and ethics, we're talking about we work with individuals of other professions to maintain a climate of mutual respect and shared values. And then when it comes to roles and responsibility, we want to use the knowledge of our very own roles along with those of other professions to appropriately assess and address the healthcare needs of the patient or population that we serve. And then when it comes to the third bucket where it says interprofessional communication, we want to be able to communicate in such a way that we do that with the patients, with other stakeholders in a way that is responsive and respectful and responsible, and it supports a team approach and the maintenance of health of whichever population or whoever we're serving, right? And then when we come to the teams and teamwork bucket, it's about us applying the principles of relationship building and principles of team dynamics in such a way that it is efficient, it is effective, it is safe, timely, and equitable. So that is where all those 4 buckets go into, which form the 4 competencies of having an interprofessional group. Next slide, please. Okay, so now that brings us to today's information about about facilitation. How do you define facilitation? Okay, it's defined as a technique in which one person is going to try to make things easier for others. It's about enabling students to learn with, from, and about each other, so because nobody is a blank canvas, everybody have their own little needs and information, so that when they kind of meet and come across this information, they're able to make their own meaningful conclusions. So, and it's about facilitating interprofessional learning groups in such a way that you are very much aware that it is a process. And a facilitator's role is to basically focus the group and foster cooperation, as well as recognize that it is quite complex and it demands, it is, and also a demanding activity. Next slide, please. Okay. Oh, can you just advance back? I'm so sorry. Okay, so essentially, if you can look at that schematic of facilitation, you have those focusing, you focus the group, you engage them so they can build a consensus and work with each other, right? And then they practice active learning that kind of helps to, that they are gathering information and reflecting and trying to balance their learning and basically their intuition, what they already know, and trying to balance what they're hearing and everything. So next slide, please. I'm sorry. Okay. Next slide. Okay. So you basically find that when it comes to facilitation and student interaction, you have three perspectives. One of them is facilitator control, in which case the facilitator is actually trying to give more like giving a ground rule to let them, setting them off, to let them know what it is all about. And then facilitator driven is most likely you want to try to encourage the students and to help them animate the group by making them talk about themselves or ask each other questions and all. And then it can be student driven in the sense that they take ownership. The students take ownership of the conversation and they're able to do that very well. So next slide, please. Okay, so we have to think about what are the competencies needed for facilitation, for an IPE facilitation. And number one, you have to have that commitment, that passion about embracing IPE needs to be there. And then, of course, you need top administrations that will be, I'm sorry, I was distracted by the chat and the thing that popped up. Okay, the top administrative officials that will champion your cause. And of course, that is going to foster buy-in by everybody along the line. You want to be able to value diversity, understand roles and responsibilities of other professions. And then, of course, it's very important you understand group dynamics, because that is so critical, and positive role modeling and everything. Next slide, please. So you find that when it comes to IPE facilitation, what you need is it's almost like an equation. You have this role here, and then you have the skill here that you have to kind of bring together. And then, of course, you kind of meld it into that, into those 4 buckets of the IPEC core competencies, and modeling all of that will kind of help to have a very successful facilitation. Next slide, please. Okay, so we are going to be talking about, facilitation does have its challenges. It's not simple, it's not easy, but then you find that some of the challenges you might find is you find yourself having to manage the tension, conflict, or breakdown and communication among the learners, or you probably have to manage the scenario that is happening or the case that you are dealing with. Is it addressing all the different professions that are present? So these are some of, a lot of them, or lack of understanding about the profession and all that. Because when you look at it, you and I, many of us in the profession, we've been stuck to our very own silo. So we basically find ourselves going back to where we were, okay? And next slide, please. So what are the strategies to overcome challenges? Well, number one, we want to ensure that those students are learning, they are basically learning with, from, and about each other. Okay, we want to be able to facilitate introductions with icebreakers that kind of makes everybody, crack them up and make them laugh and all. We want to be able to foster a comfortable, safe environment that is open, inclusive, and be able to encourage those who are the introverts to kind of, you provide a path for conversation for them. And those who are extroverts, you want to be able to kind of find a way to get them to start listening to their peers, right? Okay. And so next slide, please. Okay, so what are the strategies? Continue with the strategies to overcome challenges. We want to be able to facilitate conversation, not necessarily the content of that scenario that you're dealing with, because the objective is to foster that. And you want to make time to debrief. That way you're able to say, okay, what did we do well? What could we have improved? How can we do things differently? And most important of all, you want to be aware of your own biases and stereotypes and perspectives about and towards other profession, and work on yourself to make sure that you mitigate that. And with that said, I believe the next slide, we're at the end of my section, and I'm going to hand it over to Karen. Thank you.
Thank you, Teresa. I really appreciate it and thank for the opportunity to be here today. We're so excited to share our case study with you. And so in 2018, we held a collaborative family fall festival. And this was an interprofessional effort where students learned with, from, and about each other while educating underserved community members. Next slide, please. And so this didn't start just on a whim. I just wanted to put this little timeline in there so you could see that this group of interprofessional faculty started working together when we were working on an activity with the prenatal clinic. We got a little focus group going. We put together a poster. We submitted it at the IPEC Symposium in the fall of 2017. And we continued to work together to form relationships amongst ourselves. And we put together this community event. So it was an interprofessional collaboration, and we involved WIC and the prenatal clinic. Next slide. And so with our event planning, we looked at our target market. We were working with WIC, and so we would have WIC participants and then the prenatal clinic participants. And we also wanted to invite people from among the community. And so we collaborated with local partners. You can see the Fire Department, March of Dimes, Farm Patch for some healthy snacks. And we got our participating disciplines all lined out. Each discipline had a faculty representative who was working with those students within that discipline and gathering those students together so that we could work on that interprofessional aspect of this event. Next slide, please. And so we had to look at some target community considerations in all of this planning. One of them was cultural diversity. And so we really designed our education materials to meet our participant needs. We knew there would be some language barriers, so we got students who had bilingual ability as well as we had bilingual handouts. With the income status, financial assistance information was provided by WIC. With grocery store assistance, our area we had this, we knew there was limited grocery stores, so we actually did basic nutrition guidance, and we taught the participants to read the package label, and we had a package label in English and in Spanish, as well as other My Plate tips, which we had in bilingual languages. Available resources that we thought would be helpful for the participants. We had dental hygienists bring toothbrushes. We did relaxing scrubs. BV CASA, they provide counseling, and then immigration services. So we were trying to provide resources for all who would be in attendance. And our event location was very convenient for transportation because we were right there by the bus station in Bryan, our community, and we were on the grounds of the prenatal clinic and the WIC clinic. So that was a common area for the participants who were coming to our event. And with diverse age groups, we knew that we wanted to provide education materials to the parents, but we also wanted to engage with the kids. So we created kid-friendly activities so that, you know, the kids could be busy and have some healthy snacks and do bounce houses and things such as that, while the parents actually were getting some education. You can see we had a fire truck there too. So thinking about, you know, our first responders. So next slide, please. And so this was our initial communication. And so this is just a demonstration of our bilingual capacity that we provided. So you can see we had a handout or flyer in English, and we also had one in Spanish because we did really want to attract the market of that particular community. Next slide. And as I'm talking about this, I know we're in the Bryan College Station area, but the one thing about this that's so unique about this experience is it can be done in any community. And that's something I really want to reinforce with this. And so this is our demonstration of our event setup. And so you can see the disciplines that we had. What we did is we aligned the disciplines at tables together, and so they were sharing messages. That was intentionally done so that they would dialogue together and could share information with the individuals participating as well as with each other. And so putting our students intentionally together. Next slide, please. And so we got there, we got it all set up, but where are our participants? You can see the streets are bare, and so that was a little bit of an issue. So next slide, please. So the facilitators and liaisons of the faculty, we started talking with our students and just about the given situation, and the students started reaching out for materials like poster boards and markers and things like that. They got some of these things from WIC, and they're like, let's go make signs. Let's go make signs so we can go hold them out by the street and start to attract people. And so you can see the students leading, they're making the signs, kind of just shows the transfer of this activity. And then at the end, they have two great signs, and the students, these are students from different disciplines out there standing on the side of the road trying to attract people to come to our event. And this did work. We also went, or some of the students also went to some of the locations around where we were having the festival to also attract more people to come and join in with us. Next slide, please. And so we really felt proud with the fact that we were able to promote the with, the from, and the about. And you can see the students standing here, conversing with each other, learning about each other, also in the fact of, what does each discipline do? What can they contribute? And they learned about that teamwork, how they could come together for a common issue of providing good quality information to community members maybe who did not have access to that information otherwise. Next slide, please. So in evaluation, the things that we felt that we did well, we invited some relevant partners that we thought would be appropriate for our members, our participants who would be attending. We spent a lot of time doing event planning. We, as the liaisons and faculty members of the disciplines, we worked well together, trying to make sure that we had all of our students engaged. And we did start early by forming a relationship with each other prior to the event itself. We sought interprofessional collaboration, and so we were very intentional in integrating our students at the tables so that they could share information with the participants as well as with each other. And then we also did a faculty debrief and planned for a future event. Our initial plan was to have this a little more often, and our faculty debrief told us, or helped us recognize the areas we needed to improve, and maybe to do this on an annual basis as opposed to the frequency we initially were considering. And so we really felt good about that facilitation of interprofessional student learning, and our students had great feedback, and I think that was primarily shared to their faculty liaison. And that leads me into the areas of improvement, because I felt like that our communication, while we communicated together well, I believe, as faculty liaisons and with our students, we did not communicate as well with like WIC and the prenatal clinic. And so that inhibited our marketing plan, because that was something that they had indicated in a meeting they would be working more with the marketing, and that didn't happen. And so that was our barren streets. But then we found out it really worked out to be really good, because our students took the lead and they started advertising and showing their passion and drawing people into our event, which it did increase our numbers. We did not have a chance for the formalized student debrief, which we should have done and which we will do in the future, and nor did we do a post-evaluation, to gather any particular assessment information. However, our focus is really on what we did well, and we definitely know, how we can improve for the future, and that is going to be our goal in doing this again. And next slide. So we're open for dialogue now, and however we can answer any questions, and we definitely are interested to know your thoughts on maybe how we could improve our event. Thank you. You're muted, Chris.
Thanks. Thanks so much to both of you for sharing about what it takes to facilitate interprofessional learning groups and providing that example through your case study. I see that we have a question that's come in already. You mentioned the importance of facilitator debriefing. And Robert is curious if you used a formal debriefing framework or model, and if so, what was it? Or was it more informal?
It was more informal, actually. So we didn't debrief exactly that particular day. We did a little bit of debriefing, but we scheduled an event with the facilitators a week later, where we had taken notes at the event, and then we met together and talked about what went right, what went wrong, but we didn't have a formal method that we used. It was more just in dialogue exchange in our debriefing. And Teresa, if you want to add anything to that.
Did you use the typical sort of team steps debrief, the sort of what went well, where could we improve, what would we do differently?
Right. That's the approach that we took, kind of what went well. And we individually did that, after the event. And then we brought our notes to the event where we exchanged dialogue when we met at a later time.
Other questions about facilitating interprofessional learning groups? I'd like to actually ask the participants what challenges they've had in the classroom with, and by classroom, whatever that means, right, in clinic or in didactic activities. What challenges you've had with facilitating interprofessional learning groups?
Before we mention that, there was a question that came in the chat box. Can I answer that real quick,
Yeah,
Chris?
go for it.
Yeah. So the question was, did students identify the topics that we presented at the health fair? And I would say that each liaison worked with their own individual students as to pulling that together. So we didn't have a collective meeting and say, okay, this group will do this group will do that. With our students, the liaisons did that. And then, like, for myself, I'm a dietitian. And so I went back to my nutrition students and we talked about what would be the best information for this particular population that we would be serving. And of course, that's where that aspect of, having a bilingual nutrition panel, bilingual handouts, especially like the My Plate, things like that. We really tried to provide resources for the community members that would be present. And that was, did have student input as we selected our materials for the event.
Yeah, and I did work with the pharmacy students, and quite a number of them were very interested in making posters, recognizing that we have expectant moms and young families. So that kind of guided the educational materials that they had to prepare both in English and in Spanish to be able to give out and be able to counsel the parents and the expectant moms, especially, for instance, if they happen to have like a gestational diabetes and things like that. Mm-hmm. One thing I can say is that the outcome of this, of the weeks of preparing and talking and planning, what that did was help us to forge a relationship with individuals right from across the campus that we have from different colleges that we have never met. For instance, Karen and I, since then that was how we met, and we have kept on from there, and a whole slew of other people, both from nursing and psychology, public health, and all. So that's really, really forged that. And I think that really kind of builds a small community of faculty facilitators who are ready to go and kind of foster this information in their different disciplines.
I noticed that Sharon had put in the chat box about thinking outside the box and had a topic relevant to the community, like diabetes, and students work together to plan the event. I think that probably would have been one of the things that we should have done better, is how we had faculty liaisons working with the students. The students, the morning of course, did engage with each other, and we set them up. We set them up with this in mind, as far as we know diabetes is a prevalent chronic disease in the population we were serving, and so we tried to set up, like pharmacy and nutrition together, so like the meal plan and insulin and that sort of thing. But I agree that that's a great approach, and I think that it would have been better to have our students in more dialogue in advance of the event itself, as opposed to excuse me, the morning of. And of course, Robert has a comment, scheduling was a big barrier. That was part of the barrier, getting students. This wasn't for a grade. This wasn't, at least in my group, it wasn't for a grade. It was a volunteer thing. And so that was a little bit of a issue. And of course, with Texas A&M football, that was a little bit of an issue. So we, how do we handle it? We kind of just tried to set a day where there was a late game in the fall, like a late on Saturday, do it early Saturday morning, and just each of us as liaisons tried to engage students and ask them to be willing to volunteer, because again, it wasn't part of a class, it wasn't a grade activity, and so sometimes that can be a little bit more challenging.
Yeah, and that has to be a love that comes from the heart for this sort of thing. Just like I mentioned, you have to have the commitment and want to embrace that concept. And that's exactly what we saw. And of course, one of the things we identified was the fact that, Karen, correct me, is the fact that we felt like we'll probably have to start trying to include students, at least one student in our planning sessions, so that we can be able to see their perspective. Because when it's all said and done, students are really very good and creative. They might come up with ideas that you and I, without any of the facilitators, hadn't even thought about.
So another thing that came up in the chat is scheduling. And that is certainly a logistic that is a constant struggle with interprofessional education. I'm wondering what facilitators of interprofessional education can do to ensure that when you're working on that, you're really facilitating, those qualities that Dr. Ofili had brought up earlier, about leading, about being respectful of other disciplines and things like that.
Yeah, I believe that was something that we actually modeled very well during our planning session, because a lot of times not everybody was able to be there. We tried as best as we can to kind of schedule around what is convenient for the most number of people. So yes, it was quite a challenge, trying to do that. And when you have somebody who has missed about 2 or 3 of the sessions, by the time they come back, a lot of planning had already evolved before, and then you find that it was a challenge, but we tried to rise above that and kind of go with what as best as we, knowing that we are determined to have this event, so we're able to do that.
I think that we have participated in the Operation Lone Star program here with Chris, and I think that model taught us some as well, and so we learned from that model, kind of like what I believe Sharon mentioned, and Teresa mentioned, where the most recent past year when we were able to go before COVID, we actually, Chris got a student liaison from each discipline that was going to be participating, and then that student liaison attended all of our planning meetings. And it didn't stop there, though. That student took the message back to their peers, and so they were very engaging in like getting feedback from their peers, like, okay, so what day is good, what times are good, what are you thinking about, thoughts? And so they kind of worked as a peer liaison. And I know for myself, I had a student doing that, and I am a big believer in leadership. And so I feel like, when you ask a student to maybe be a liaison or a couple liaisons, whatever, they get some leadership growth out of that, and they, align with their peers and promote that dialogue. And I think that would be one thing that we would try to do for the future. And we learned that, as I said, from Chris with the Operation Lone Star. This was prior to that when we did our event, but I think definitely to get the students involved more, and maybe with the student liaison from each discipline, or maybe 2 student liaisons from each discipline.
Yeah, and if I can just tag on to that, the model that Karen's referring to, where we include students in the planning process, and that it can be just as educational, but in a different way, than the event itself, right? And so we have other events like our disaster day, which is a really, really big event. And it takes us about 10 months to plan with about 50 people. The planning process where the students are working together across disciplines really does allow them to spend face time with each other and then develop relationships, and then they continue after the event to go to each other with discipline specific questions, but also just breaking down those barriers. And if you look at contact theory, you've got to have contact with people in order to understand them and respect them. So, you know, those types of
She's breaking up. She's breaking up.
To lead that again.
Uh-oh.
So I'm wondering if our presenters have any recommendations for people who are starting to facilitate interprofessional learning groups. What would you recommend that they consider, you know, the first top one or two things that they consider as they're learning to facilitate interprofessional groups?
Well, I'll go first, I guess, because I am actually not in the School of Public Health. And so Chris and I met because I'm probably hard-headed and I'm like, they're doing this over there and I'm not part of it. And I'm a dietitian and I want to be part of this activity.
Join us.
So yeah, so I made an appointment with Chris and I just went to her office and I said, hey, I want to be part of this. What can I do? How can I help? And what can I contribute? And I think that what I would say is don't be fearful of asking if you can be part of something. If you maybe feel like you're being left out and you have something to contribute, you know that your students would benefit from this. So I would say ask. Don't let apprehension stop you, because then you're allowing that to stop your professional growth and then also the growth of those who you may be, you know, representing. And so I feel like that's a good role modeling thing too, to set for your students, to say, hey, let's just jump in and help out. And then once that door is opened, I always try to say yes. My husband doesn't like that. He says you need to learn to say no. But I think when it comes to some of these activities, even if it's a little bit more of a hindrance on my schedule, I think that this is one of the activities, this IPER, interprofessional activities, is something that I'm going to continue to do even if I'm really busy, because I value it. And so I think that professionally, we've got to put kind of our money where our mouth is. If we value something, then we have to be active in it. We have to role model it and interface. So those are my two tips.
Yes, I totally concur with what Karen has said. Positive role modeling is important, but most importantly, being committed, being curious to know what is going on around you and wanting that opportunity to grow and connect outside the realm of outside your silo. Because a lot of times we all just feel very comfortable within the silo that we're in. But it's always a good thing, because we live an interrelated world. And like I always tell my students in communication as well as social behavioral, see, for instance, now, some of the students will wonder, why are we studying this behavioral thing? Yeah, you deal with human beings, that's why. Mm-hmm. And we have to understand human behavior and all that. So it becomes critically important that we are, I want to say, all-rounded is what I want to say. We want to be well-rounded, not just to stick in that silo, and be committed to that change. So
how do you handle when you are facilitating an interprofessional group and addressing students who are outside your discipline? Do you find that more challenging?
You know, I think a lot of it is kind of just your approach. I feel like try to engage them the way that I engage my own students, you know, be aggressive by self-introduction and introducing students and trying to do those kind of icebreaker things so that they feel comfortable around you and they feel comfortable to approach you if they have a challenge. I mean, and so I think that aspect of helping the students feel comfortable in an environment helps to minimize any barriers that might exist, you know, because of the discipline situation. So
Yeah, I think basic, simple human connection, it's all it takes, and being observant, being cognizant of that nonverbal body language and all. So it just kind of helps us to just be able to connect regardless of what the discipline is. And then, of course, from trying to ask questions again, like getting to know each other and getting to know, okay, what do you think about this? So how do you see this? Trying to get their perspective. And I'm learning from their perspective of why they think what they think, and I sort of prompting them to be able to be open and talk, and recognize that it's a safe environment to talk, and basically it.
I think that's real important when you notice like your introverts of your group, because sometimes people are shy. And so definitely asking those people the questions of their interests and, you know, what they want to do career wise, you know, about themselves. And that generally people know more about themselves than anything. And so hopefully they feel comfortable speaking about themselves. And so I think that's a good way to pull more introverted people into the conversation and make them feel more at ease. So, you know, they can be part of the team regardless of whatever discipline they're in. That doesn't matter. It's mattering that we want them to be a part of the collaborative effort and the team approach that we're trying to take here.
Absolutely.
I had an observation. This is Sharon Dormeyer talking. In the slides, could you go back to the picture where the students are standing around talking? Is that possible?
Sure.
That one. It really strikes me the separation of the students into two groups, and it's the white coats that separates them. And all the other students, I can pick out the nursing students, but they're all intermixed. But the college with the white coats is all separate. And that just struck me when I saw it. So when you're talking about unity and stuff, if everybody had just the t-shirts or polo shirts or whatever, that picture might have been very different.
May I speak to that? Okay. So actually, yeah, in that, those are students from College of Pharmacy, and they always require that when they have to go out into the community to do that, they have to, it's part of their professionalism to be able to appear that way. But unfortunately, you didn't have some of the other ones you didn't see some of other pictures that we shared where they took off their jackets, they kind of put it somewhere or held it in their hand, and they were out and about talking and taking pictures and they're chatting here. You're right. Very excellent observation. Because I noticed that too.
Yeah.
I was thinking to myself, so you are very, very observant, because I looked at it, I'm like, okay, somebody might say something about this.
Sorry.
That's likely a result of them knowing each other, right? You know, they know each other.
Actually, I don't think they even knew each other before that day, but look at they are talking and all that. They did not know each other before that day.
No, none of them knew each other before that day unless they had an interpersonal relationship before this event. But if you go back a few slides, Demetria, there's an example, I believe, where go back maybe, there. You can see the student who has her coat over her arm, you know, and so that in itself, respecting, of course, the College of Pharmacy. But I think that even with that picture did appear that way. You're correct. But I think that we found that integration was really good in their activities and the other components.
Yeah.
So thank you for pointing that out, though, because that is definitely something that we would not want, that separation amongst the
Absolutely.
participants.
That's very observant. Yeah.
Well, thank you both so much